Hi, everybody. My name is Michelle, and today I'll be talking about nonverbal communication in healthcare. So, picture this: you wake up one morning and you're not feeling too well, so you decide to call out of work and go to the walk in. When you get there, the receptionist is being pretty cold and giving you one word answers, not making you feel very welcome there. So, you're just hoping that when you get into your room, the doctor will be much different, much nicer, and you'll get your medication and be on your merry way. However, when the doctor walks in, he doesn't even introduce himself. He just sits down, clicks on the computer without even saying anything to you at first, and then finally he'll ask, "Oh, how are you doing today? Like, what brings you in today? Um, how would that make you feel?" Even if he said all the right things and did everything perfect from there on out, would you feel very comfortable with your care in his hands? Because I don't know if I would. As a dialysis technician, I see firsthand every day how patients typically respond to nonverbal communication. I also use and watch nonverbal communication every single day to provide the best care that I can to my patients. After 10 years working in healthcare, I have learned that what is not said often matters just as much as what is said out loud. Everyone has been a patient at one point or another in their lives. The relevancy on understanding how nonverbal communication works in healthcare settings is crucial to everyone, not just to medical professionals. Nonverbal communication is an essential part of healthcare because it helps build trust, presents challenges and barriers that must be overcome, and allows healthcare professionals to recognize patient emotions to improve outcomes. Since trust is the basic foundation of any healthcare relationship, we should begin there. Nonverbal communication helps build trust and comfort. Maintaining eye contact while speaking with your patients shows that you are trustworthy and interested in what they have to say. It shows them that you are saying, "I am here for you and I care about what is going on," without actually saying those words out loud. Patients feel like they are being heard, which will encourage them to be more open and honest with you. Our facial expressions give away what we are feeling, whether we want them to or not. Being aware of our expressions can help us show empathy and sincerity. A genuine smile and warm expression can ease anxiety in patients. Body language can help show open engagement. How you position yourself while speaking to the patient matters. You should be sitting face to face with them to show them that they are your only focus in the moment. Communication will flow more smoothly if patients know you are interested in what they have to say. In my experience, patients are visibly more relaxed when you offer them a warm and friendly presence. I have personally seen certain patients be more open and trusting with certain staff who are more attentive. Building trust is vital, but in the real world, there are challenges and barriers that can get in the way. Patient-side barriers can cause nonverbal cues to be missed. Nonverbal communication can vary from country to country and among cultural groups, mostly in the use of eye contact, physical proximity, and touch, all of which can affect the intended meaning. Language barriers can increase the risk of interpreting other people's nonverbal cues. Provider side challenges can reduce the quality of nonverbal communication. Healthcare providers are gaining more and more patients, which can make their schedules jam-packed. Because of this, some providers are not as present for all of their patients as they should be. They are experiencing burnout, which makes providers seem uninterested, even if it is unintentional. Face masks can block important facial expressions that healthcare providers would otherwise be able to read. During COVID, I learned how crucial nonverbal communication is. When all of us had to wear masks, it was hard to tell how exactly a patient may feel. Despite the many challenges healthcare providers can face, recognizing patients' nonverbal emotions can become one of the greatest tools for improving care. Recognizing patients' emotions and needs through nonverbal communication improves patient care and outcomes. Facial expressions and body language convey deep emotions, often more sincere than spoken words. They allow you to detect signs of worry, pain, and reluctance, which are essential in healthcare. A patient may tell you that they are feeling fine, but if they keep making faces or frowning, this can indicate that they are in some kind of pain or discomfort. Fidgeting may show that the patient is feeling anxious or worrisome. Poor eye contact and behavioral changes may also show unspoken challenges. Recognizing these cues early on may lead to better patient outcomes. The ability to decode the unspoken helps adopt interventions, better meet expectations, and offer personalized support. This form of communication, excuse me, this form of communication can also strengthen motivation, reduce resistance, and establish a well-meshed dynamic between the caregiver and the patient, which will increase the effectiveness of care. Dialysis patients come in for their treatments typically 3 times a week for years at a time. Session after session, we build a rapport with them, some more than others. Every smile, reassuring nod, and a simple squeeze of the hand are simple moments that build up over time. This helps make it easier for our patients to come back every other day for their life-saving treatment, even when they don't want to. Nonverbal communication can help build trust in healthcare. Even though there are many challenges that need to be overcome, the quality of patient care is what matters the most. So, throughout this speech, I shared with you the importance of nonverbal communication in healthcare. First, we discussed how nonverbal communication builds trust and comfort between patients and providers. Then, we explored the challenges and barriers that both patients and providers face every single day. And finally, we looked at how recognizing patient emotions and needs throughout nonverbal cues leads to better patient care and outcomes. Nonverbal communication is a powerful tool in not only everyday life but in healthcare that goes beyond what spoken words can do. While healthcare professionals rely heavily on medical knowledge and technical skills, sometimes the most meaningful communication happens without saying a word. Thank you for listening.